All right, we're here in the office today, and I want to show on this side of things what it looks like as far as insurance breakdowns and eligibility checks, and why it's so important that we are, one, getting a lot of those in the call center, but then also what we do when, say, a new patient walks in the building and gives us their insurance for the first time. So to go over the process again, when we have the new patient, we bring them in, we do the new patient interview here in the office, and then as soon as we pass that new patient on to the back office, we've got about 15 minutes in order to make sure that the insurance information is entered properly into the system so that when the doctor is done doing his treatment planning, the insurance information should be entered so there's not a delay between him finishing up his treatment presentation and us then being able to go in and present treatment. So the way that we do that, and we've got a patient here, so the way that we do that is if a new patient walks in the door, I'm going to focus on PPOs first. When a patient walks in the door, they've got PPO insurance, and we did not have a chance to check it prior to them coming in the door. Say it's Sunday and it's 6 p.m. Insurance company is closed, can't give them a call. A lot of the information that we need to get is online. So what we do, we've got the screen here. What we're going to do here is I'm just going to go over here and in your toolbar on the top, if you're logged in correctly, in this example, I'm going to use Delta Dental, but we've got a login sheet that has all the other insurances as well. In this case, I've got Delta Dental already saved up here. I'm going to go in here and I'm going to sign in. Now, one of the key mistakes I see people make is they'll oftentimes try to log in. This is trying to log in as a patient. You need to make sure that you go over to the For Dentists page, go over to the dentist homepage, and then log in. And this will allow you to log in as a dentist. Again, if you're logged in properly into Chrome, the username and password should be saved, and you can just hit the login button. And again, MetLife, Guardian, a lot of these will have a similar site. It'll look a little bit different. Right now we're doing Delta Dental, but they'll all have something similar. What you're going to do is you're going to go over here to eligibility and benefits. You're going to go to new patient. So in this case, we're going to search for a patient that we've got on the schedule. Pretend they're a new patient that just came in the door. I'm going to go in here and we're going to take a look for them. While we're waiting for this to load up, something that's important is a lot of times when we're working here in the office, we're busy, right? There's patients that are coming in the door that need to be checked in. There's patients that are coming out that need to be checked out. I may be receiving a call from a patient. There's stuff going on that I need to handle. So for me to sit here, to expect to sit here for 20, 25 minutes and do a full breakdown over the phone with the insurance company or even online with the insurance company is unrealistic. And so in the office, what we want to do is we want to get the minimum required in order to present a proper treatment plan to the patient. Very important. And so the first thing that we do is we get the general plan information online. And again, for the vast majority of the patients that walk in the door with PPO insurance, you're able to get this information online. So we search for the patient, and then we go in here and we enter the birthday. Now, with the name, date of birth, and occasionally the social security number, some of them require social security number and ID number for the patient, we're able to get in on the insurance website. So here we go, find patient. And we're going to be able to begin getting the information that we need to enter into the computer to get this patient ready so that their treatment plan will be correct and we can get them entered. So here the patients come up. I'm going to go over here. I'm going to click on View Eligibility and Benefits. And then it's telling me as of today, here's the patient's eligibility level. So you can see here, like basically diagnostic, preventative, covered at 100%, restorative is at 90%, root canals are at 90%, perio is at between 90 and 100%, prost is covered at 60%, ortho at 50%. So you can kind of get an idea of what the coverage levels are. And so we're actually then able to take this information and get it entered into Open Dental, just kind of the basic information. So when we do that, we can just click over here in Open Dental, we add the insurance, and then we go in and we enter in the basic categories and what percentages they're covered at. We're also able, if I click back over here, we're also able to see what the annual maxes are. So you can see here, this is for calendar year individual annual max for PPO dentist 2,000. So I'm able to see that. I'm also able to see their deductible. So again, this is for a PPO dentist, $50 on the deductible. So I'm able to get this basic information. I'm then able to go into here. I can enter in their annual max, their deductible, some of the basic information that I need in order to be able to present treatment to the patient. Now, let's say, and this is like just with this simple thing that I've just done, I'm able to present fillings, root canals, crowns, SRP, a variety of the services that we provide. Let's say though, for example, that this patient needs an implant, ortho, and a sinus lift. Okay, so like not normal procedures that our average patient might need. What we do in this case, we can go back over here to online, and we can actually go in here. Oh, and they need a filling replaced, but they might have had it done recently, so we need to get history on it, right? And so in this case, what we're going to do is we're going to take a look and see what information we're able to get online. And so a lot of the times, so for example, here in Delta Dental, on the treatment history side, we're able to click on treatment history. I can either search by code, or I can just scroll down through the bottom, and I can say, for example, I want to know about the fillings, right? So here's the teeth that have had fillings, teeth numbers, the dates they were done, and the benefit, right? So in this case, it was done 10 years ago. It's allowed to be replaced every 24 months, so we're good to go. So I know, like, okay, it's covered, we're good. And I can enter just that information that I need for that particular tooth into the treatment plan to make sure that the insurance is shown appropriately. Same thing for things like for implants or for sinus lifts. If there's a particular procedure that I need to search for, I might have to dig in, right? And go in here and say, for example, implant services, and it'll tell me what's covered, what the comments are, so I can look in here and get some of the information. Let's say, for example, though, that sinus lifts are not included. The information is not available online. This is when you pick up the phone and make a call to the insurance company. Okay. And so I would say for 85% of the new patients that walk in the door, online, we're able to get everything that we need. And then for like 99% of the new patients, we're able to get almost everything we need, except for maybe one or two particular items that we either need to call and get on the phone, information over the phone, or it's a procedure that we have to maybe tell the patient, listen, we don't know what your coverage is. What we can do is basically they're going to pay the agreed upon amount, and then whatever the insurance pays, we will reimburse them for. Very common ways to deal with things that we're not able to pull online. So again, patient comes in the door and we don't have the insurance checked. Being able to go online, don't call right away, because if you call, you could be on hold for 20 minutes. If you go online, I'm able to go online and pull this stuff in about 3 minutes. Pull it, enter it into the system. It takes me about 3 minutes to get the basics in there. And again, that covers about 80% of what the patient needs, or 80% of the patients. And that it's done very quickly. And the phone, calling the insurance company is really like the last resort that you should do. Also, for the call center reps that are watching this, as you can see, trying to pull this information while there's patients coming in and out, and while you're trying to deal with other things that are going on, it's very difficult to do. So if I have 30 patients coming in today and none of them have their eligibility checked and none of them have their full breakdowns done, I'm toast. Like, it's impossible for me to handle that load of patients. That's why it's very important we get as many as we can, so that if a patient walks in and says, oh, I have new insurance, or a new patient walks in the door and says, oh, I didn't know what it was when I called, but here's my insurance card. Those are the patients then we can dedicate some time, get in here, do the work to figure out what it is that we need to do as far as the insurance is concerned. Perfect. I think that's a good overview. Thank you, guys.